Good evening, everyone. Thank you so much for joining us today. My name is Jennifer Jackson, and tonight's topic is navigating cancer through COVID. This event has been brought to us by the National Coalition of 100 Black Women, DC chapter, and the Cancer Support Community. Being as though it's October, I am happy to be able to participate in this. I am a breast cancer survivor. I was diagnosed at 33 years old and had no family history of it and was relatively healthy and definitely not expecting a cancer diagnosis. But I have a blog that is theyoungandthebreastless.com that shares my story in a very honest and kind of comical way. And so it is something that I have used to inspire others. So we hope that today we will be able to provide you with information and inspire you and give you the tools to fight through cancer during COVID. I would like to introduce our wonderful panelist, Eukarya Borden. Eukarya Borden is Senior Director of Health, Equity, and Clinical Services at the Cancer Support Community. In this role, she's responsible for ensuring that CSC headquarters research, program, policy, and operations integrate relevant components of health equity, inclusion, and social detriments of health across all activities. She also works with the leadership of the Institute for Excellence in Psychosocial Care to inform the CSC affiliate network on best practices in health equity. In addition to a focus on health equity, she is responsible for establishing new headquarters programming, as well as ensuring the highest standards of care for people impacted by cancer diagnosis. Prior to joining CSC, Eucharia worked for nearly 20 years in direct practice with adults living with chronic illness. 12 of those years included patients in acute, inpatient, and outpatient oncology settings. So before we begin, I would just like to say that the content of this program is for informational purposes. We advise you to seek medical advice from a physician. This is just us having a conversation and giving you some insight on tools that you can use during this time. So, Eucharia, thank you for joining us.
Thank you for having me. Happy to be here.
So to get started, can you just tell us a little bit about what the cancer community, the cancer support community is?
Absolutely. So we are a global nonprofit that provides $50 million in free support and navigation services for patients and their loved ones. Loved ones go by different names. Their loved ones, their caregivers, their care partners. And, we're there to help people who are affected by cancer to navigate through those treatment decisions, connect with others who are going through the same experience, and also just to receive guidance on everything from nutrition to finances.
I would say that I can't even imagine going through a cancer diagnosis during this time where you're not even allowed to have a loved one in the room with you, help you navigate and help you go through treatment and decision making and all of those things. It is such a scary thing, and I'm so blessed to have had the opportunity to navigate that with my partner. How would you say the coronavirus has impacted people living with anxiety or living with cancer?
Oh, there have been many ways that people living with cancer have been impacted by coronavirus. We've seen an 80% increase in calls to our helpline. Traffic to our website is up 40%. We've got a digital community called My Lifeline, and participation in those discussion boards in particular, they've gone up by 20%. Our publication about coping with the cost of cancer, downloads are up by 33%. People have always needed information and support, but what we're seeing is an increase across all of the platforms that we have to offer support, just increasing tremendously.
That's amazing. Yeah, there is so much. I remember when I was going through it, how overwhelmed I felt, and just, there's so many decisions that you have to make, and it's amazing to have a community and an organization like yours that can help us and help other women and men navigate that. What are some of the things that the cancer support community is doing to help patients and caregivers during this time?
One of the first things we did was to create a landing page on our website at www.cancersupportcommunity.org/coronavirus. When you think back to those early days, even now, there's a lot of information. If you're watching one news program, for example, there are experts, then there are people who are giving their opinions about the experts, and it's a lot of information, even when you're not dealing with cancer. And so we really thought through that and realized that people need information, but we wanted them to get it from trusted sources. Because one of the things that's difficult is trying to sort through, who do I listen to about what? And so we wanted to make sure that people had the latest updates about what's going on in the government, what's going on with where to get access to testing, any of those kinds of things, maybe about stories that are about hope and inspiration. So we created that webpage as one of the first things that we did. The other thing that we wanted to make sure people knew about is how to connect with each other. And so we made sure that people knew, even if they had never visited our website before, how to connect to our digital platform. All of our services are free. And we've seen an uptick, as I just stated, in our My Lifeline community. So we wanted to make sure that people could get the facts, but then they could also easily connect to other people who are having similar experiences to themselves. Both of those things are really important.
Definitely. I remember just feeling like, the narrative or the statistics have been like, oh, you don't have to worry about breast cancer until you're 40. And I'm 33, what's happening? And so it was really hard to find a community of people that would be able to kind of understand what I was going through, to find the information, because there's a million different websites that have factual information and information that can be misleading, and it's a lot of stuff to take on. So your organization sounds like such an amazing and very helpful tool for people like me that were going through something that was so unexpected. Can you tell us a little bit more about the helpline and resources you have available in care for patients and caregivers? What are some of the concerns people are usually experiencing when they reach out?
Yes, absolutely. So our helpline is another free service where you can talk with our resource specialists or our navigators. We have licensed professionals available. And, in terms of the things that people call us about, it's about everything that you can think of: financial concerns, housing, transportation, how to find support, how to communicate with your doctor. It's really about how to do life with cancer. There are just so many things that we have to navigate in our everyday lives. And so whenever there's that cancer that enters into the picture, that uninvited guest that sometimes lingers, right? That stays there a lot longer than anybody plans sometimes, or maybe not. But it's difficult to think through all of the new information, all of the new terms, all of this information that's coming to you from your healthcare team. And then there's the other stuff that you have to do every day. When you're a parent who is raising children, you're going to have certain concerns about talking to your children, about putting food on the table, whether you are a caregiver or maybe you're an elderly patient. How am I going to get to treatment? During this time, people are wondering things like, is it safe for me to go into my doctor's office? So we hear so many concerns that people have. And we are there Monday through Friday, 9 a.m. to 9 p.m. Eastern. And then we actually increased our helpline hours to include the weekends to go to 7 days, Saturday and Sunday, from 9 a.m. to 5 p.m. Eastern.
That is awesome. I wish that I'd known about that when I was going through what I was going through, because there's so much information and it's being thrown at you, and you're like, okay, is this the right routine for me? Am I doing the right thing? I remember going into the doc to meeting with my oncologist and being like, I felt like she was speaking like French to me. And it was just like, wait, what did you say? And I literally had to like record what was being said to me, because it can be so overwhelming.
Mhm.
At the same time, when you feel like you are alone in this, it really is a scary feeling. And it's
Absolutely.
something that it's amazing, the resources that can say, hey, I can help connect you with other women or men. I can help you connect with people in your age group. I can give you information about how you should proceed with treatment. And that's really, really helpful. So I'm very, very happy to hear about that.
Yes.
Um, how do your navigators work with patients? Like, what should callers expect when they call?
One of the most important things I want to say is that people often tell me, patients and caregivers often say, I don't know what to ask. And it's hard to know what to ask, especially when there's so much information that's coming at you. But the really nice thing is when you call our helpline, you don't have to worry about knowing the quote unquote right questions to ask.
Mhm.
You know, call and just talk about what's going on in your experience. Where are you? What is it that you're wondering about? And from there, when you call, someone is already assessing what you're saying. They're already thinking about, how do I create a personalized plan with this particular caller? So that's the first thing, because asking for help can be so hard to do, because there's that added pressure too of figuring out, what do I say? And so that person on the other end is going to be walking you through those steps. So I just want to say that at first. But we have a distress screener. And essentially, what that means is that it's a series of questions that really just helps our navigator to get an idea of what the caller's needs are. And once we can determine what your needs are, then we know what to do from there. Maybe you need emotional support. Maybe you need help talking through some of those, how do I talk to my doctor about treatment decisions? Then we can help you to figure that out too. If it's a more practical need, like I was talking about before, in terms of how do I get to treatment, or how do I put that food on the table, then maybe what we're going to be doing is actually having more of a resource conversation. So when they call, they can expect to be greeted by someone who's enthusiastic, happy to help, and someone who knows the questions to ask you, so you don't have to worry about what to ask us. Just call and talk about where you are. We're really ready to meet you where you are and help you figure it out from there.
I think that's fantastic, because I think for me, the biggest hurdle was being emotionally strong and just in a positive space to get through it. And I know that I had such a large community of people around me that supported me and that cheered me on, but I know that everyone doesn't have that. And I know that there are people that are, like you said, that don't have access, that don't have, the proper guidance, and they may not even have a way to get to treatment. And then you're also kind of like, you know, is my doctor telling me the right thing? Should I get a second opinion? it's amazing to have that kind of resource at your leisure to talk through that and kind of figure out what you should do next.
Mm-hmm. Absolutely. It's all of those things. It absolutely is. And we don't offer medical advice in that way. So I want to be clear about that too. But for those pieces, even that medical advice piece, especially like you're saying, figuring out who to trust and what to trust, that's huge. And so while you have your healthcare team, but even understanding what that means, what is a healthcare team? I mean, we have people who would tell me, I've never been sick before. I haven't had to
Right.
spend more than a night in the hospital. Like, even just that language of a hospital, all of these things are brand new.
Right. Yeah. It's a lot to take on, and and then you think about like financially, like how am I going to cover that? People that don't
Mm-hmm.
have health insurance, or people like me, where they're like, do you have kids? And I was like, no. They're like, do you want kids? And I'm like, yes. And they're like, okay, well, before we even start treatment, you need to fertilize, you need to, store your eggs. And that was like a whole nother thing that I hadn't even thought about, and
Right.
it's just, it's great to have, even if it's not medical advice, just the tools to say, hey, Live Strong is, a tool that you can use um, to get help financially with storing your eggs, or whatever it is. So
Right.
it's great. One question that came up is whether or not it is safe to go to the doctor or proceed with their treatment at a center or hospital. How do you advise patients to address their concerns?
So this is a perfect example of the kind of question that we would get. And because we don't offer medical advice, when you call, we're not going to tell you, yes, it's safe to go. No, it's not safe for you to go. We have callers from everywhere, literally everywhere across the United States. And so what we do instead is help callers to understand how to utilize their healthcare teams. That is really important. Sometimes people think about their healthcare team as just that. They can only talk to me about my health, my treatment, and those things, and that's it, like in a box. And actually, that's not the case. They can help because the team of professionals is not just the doctor and the nurse. There can be a nurse navigator, there can be an oncology social worker, there can be a dietitian on that team. That healthcare team is actually bigger than we probably realize because you're interacting most often with the doctor maybe. But sharing your concerns about something like, do I come into the hospital? Don't I come into the hospital? What should I expect? What we would do here is actually redirect you back to the team and maybe help you figure out how to have that conversation with that team. Because that might be a question just about that, but that exercise can help in the long run as well in terms of thinking about how to ask those questions. It's like coaching in a way when you think about it.
Right. Yeah, I had a nurse navigator that was like amazing, because I was literally like in every doctor's appointment, like just bawling my eyes out, like,
Mhm.
happening to me. And I had a nurse navigator that was like, don't worry, I'm going to set up this, and this. And like, I'm going to take the pressure off of you. And so
Right.
those tools are, and having those people around you are really, really helpful for your mental health,
Hmm.
and for your physical health. Um, I would also ask, several people asked me to find out if there are any foods that can help boost their immune system. What do you recommend to callers who have that question?
So we actually have an award-winning series of educational materials called Frankly Speaking About Cancer, and nutrition is one of those topics. And so you can actually download, you can request it in print to come to your home, or you can download electronic versions of this information. So we would actually send you to that resource. In addition to that, we would tell callers to talk to your medical team again. And I know it sounds like we're a broken record, but really it's not. It's teaching people those skills that they need to really maximize the services that are there for them. So all of our materials, we have advisory boards, we've got dietitians that are vetting our materials, so any question that someone would have about nutrition, it's a starting place, our educational materials, but then we would encourage you to go a step further. If there's something that you're reading about and you're not sure about it, you want some additional information, then take that to your doctor, show them our educational resources, find out, how does this apply to me? Is there a dietitian here that I can talk to? I really want to learn more about these particular healthy foods and that sort of thing.
Yeah. And I think that when you go through this, I know personally, when I was diagnosed, I was like, I'm going organic. I'm gonna, like,
Yeah.
if it's not organic, I'm not eating it. If it has like, whatever in it, like, and it's not good for me, I'm staying away from it. And so it was just very helpful, or it was helpful to read online about like things that can help you stay healthier, and to at when you beat this, when you come on the other side of this, you have a plan of how to live a healthier life.
Right. And that's really what it's about. I mean, when you think about nutrition, that can feel overwhelming all by itself, right? I mean, think about at any time in our lives when we think about something like that, and now it matters even more. And so it's also important to think about, like you said, taking one thing that you think you can do, and maybe that's enough for right now. That's why talking to your team is so important, because of the three suggestions that you might see in one of our Frankly Speaking About Cancer educational materials. Which one of these examples of a better nutrition plan is the best one for me to start with? That could be a great question to ask.
Right. And it's important to also just know that, like, you don't have to do a million things.
Exactly.
Starting with one thing, like it's
one thing,
eating more leafy greens, or drinking more water, or being more alkaline, or whatever it is. Those things that are just these steps to help you get to, where you need to be.
Exactly.
Given the incredible number of people who have lost their jobs during the pandemic, how do you help people who are struggling financially, or who have even just lost insurance?
This is a loaded question. It is.
It's hard.
The answer is a simple one for a not so simple problem. So when people call, we do have a specialist, a financial specialist. That is the person who can help you with, like, I've lost my job and I don't have my insurance. The thing that becomes most important here is that personalized plan again, because one person losing a job and losing insurance, you would think that the concerns would be the same, but they can actually vary quite a bit. And so if someone needs to figure out what next, is there any insurance that I qualify for? That's something that we can answer a question about. Someone may have questions about, now how do I go to the doctor? Is this a hospital that I can actually continue my services? That may be the concern. Even though both of them have lost insurance, not everyone is in the same place for their concerns at that particular moment, because again, sort of like with our nutrition, there can be so many things going on at one time that we want to make sure that we assess every person to find out, okay, you've lost your job, you've lost your insurance. What have you done? What is available to you? These aren't questions that you, again, need to know to ask us. We are going to be assessing to help you figure out what your next steps should be. For some people, that might be applying for medical assistance if they qualify. Some people may be applying for an insurance plan in the health insurance marketplace. Some people just need to connect with their HR from their employment to see if COBRA is available for them. So the answers may not be the same, but we get calls quite a bit for people who have lost employment, and insurance, and that can literally feel like the rug has been pulled out from under you, especially when you're dealing with, I have a cancer diagnosis now, and I might need very expensive treatments. What do I do? It can make you feel panicked.
Yes, absolutely. And I think that the most important thing is having that support system that can say, you know what, it's going to be okay. These are the options that you have. Um, because it's scary, like I can't even imagine losing my job and not having insurance and trying to navigate how to get treatment, and it's not something that you're like, oh, I can just put that on hold. It's something that is serious, like it's life or death. And
Absolutely.
yeah, uh,
Yeah.
that's
And sometimes people just need education about some things,
mhm,
because in that moment it can also feel like you're frozen. Like what else can I do? Sometimes people are actually more equipped to take that next step than they may realize. They just need someone to help to kind of set them
yeah,
on the path. So for some people it might be help with very practical things like I need to apply for disability. I need to apply for unemployment. People sometimes have never had to do that before. So we might need to come alongside you and help you to literally learn how to do those things. While other people might say, like, I've heard about this thing called financial toxicity. What is it? And how does it affect me? So some people, even though it's about insurance and finances, they may still be seeking some sort of education in that way. Sometimes our financial specialist is on the phone for an hour and a half to 2.5 hours, maybe more, because if it takes having someone call that insurance company with you to find out if there can be a continuation of your benefits, then that's what we're going to do. And so what we do with each person varies. But no matter what it is, it is so important to at least know that there's someone that you can reach out to who is an expert in this area. And while you might be the expert on yourself and your situation, you just need to partner with someone. And that's essentially what we hope that it feels like, that you're partnering with someone who can
yeah,
help you to kind of put one foot in front of the other at a time where it feels like there's so many things going wrong all at one time.
yeah, definitely. It's really important to have someone that you feel is on your side and is like really honestly, sincerely trying to help you, because
Mm-hmm.
some people don't have that support. And so, it can be overwhelming, it can be depressing and stressful. And so, having someone to say, hey, I can help you call your insurance company, or I can help put you in touch with this organization that can help you do whatever it is that you need,
Right.
is something that is very, very important.
Mm-hmm. Absolutely. I mean, I don't know that no one plans to be in that place.
Right.
And it's not that you're not a planner. I've worked with patients who have planned. Sometimes the financial concern is that I did plan for an emergency. I did do the things that we're all advised to do, but now I'm burning through my savings and I'm going to be out of savings soon. What next?
Right. 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 Um, so a lot of people, many people are feeling like really lonely and isolated, frustrated because of lockdowns and travel restrictions, and feeling the need to stay home because their immune system is compromised. How do you help them cope?
So feeling lonely and isolated is not, it doesn't feel great, but what I can say is that it's a very common feeling. It's a very common feeling. And we do have some suggestions about how people can cope. And, through communities like our My Lifeline platform, people can still stay connected. The things that are going on in the world, we may not have control over them in that it affects whether you can go out or where you can go to and those sorts of things. However, we all have that inherent need and feel sometimes to be connected to other people. And so through My Lifeline, for example, you can still communicate with other people. Sometimes we see posts there like, this is what's going on for me. I'm across the country. I can't be with my mother who's in treatment right now. Is anybody else experiencing this? Sometimes it's, how are you coping with the stress of this? Please tell me, help me. So sometimes there are stories of hope, stories of inspiration, and maybe that's what you need to read. And other times it could be that I need help with something, some actual tangible thing. And so we're finding that people are turning to, I mean, but the world, not just for coronavirus and cancer, but the world has become digital in a whole different way, you know. And so when you think about it like that, we already have a platform in place. You can have your own private sites where you're sharing updates and, you know, those kinds of things with people that you're inviting to your personal site, whatever you want to share with them. But then we also have these discussion boards about a variety of topics. Some of it is about disease specific information, sometimes nutrition, like we've talked about. You know, it could be side effects. Some people are still trying to figure out how to do everyday life. So we have a calendar there. If you need help getting to treatment because the method of transportation that you previously used is no longer running, now you, even before this, but even more so now, you can tell people, I need help with this on these days. I need help with grocery shopping on these days. You know, so those feelings of isolation are real. They are absolutely real. And we want people to know that we at least have some solutions for how you can reach out and still feel like you're connected to a community of people who get where you are, who get what's going on. We also have caregivers on there. So whether you're a patient or a caregiver, there's a way to still feel that sense of community that's so important when you're feeling isolated.
Definitely. I beat breast cancer, I think 3 years ago now, but you know, my immune system is still compromised, and you know, I shouldn't just be out like, you know, running around and whatever. But as an extrovert, it was very, very hard for me to deal initially with, you have to stay home. You
Mhm.
to, you know, isolate yourself. And it was really depressing for a little bit of time, because I was just like, you know, I would like to go to lunch by myself and, you know, just be out, you know, and being cooped up in the house is clearly not the ideal situation for a lot of us. And the other thing on that I would say is that the support of not just the patient, but the caregiver is really
Yes.
important, because I think, you know, my husband was so amazing during my whole experience, but it is something that needs to be addressed, because
Mhm.
caregiver that is, you know, sometimes it's a village of people that are being caregivers, and sometimes it's just one person. And in my situation, it was just one person taking care of me day in and day out when I couldn't even open a can of like LaCroix. So that is something I think that is really important, that needs to be addressed, because there should be support not only for the patient, but for the caregiver.
We agree 100%. And we have so many caregivers that we interact with through our helpline, through my lifeline, and even through our educational resources. In fact, if you go to our webpage, you'll find an entire part of the page dedicated to caregivers and caregiving and tips for caregivers, you know, because you're not doing this alone. We absolutely believe that no one should have to face cancer alone. But when we say no one, we don't just mean the patient, we mean the people who are helping you through this too, because as that patient and that caregiver, you're both experiencing this. And some of it is similar, but there are a lot of things that are really different. Your husband and you probably had some of the same concerns, but there may have been some things that varied for you. So, just as important for that patient to have a place to connect to other patients, it's really important for caregivers to have a place to connect with other caregivers.
Yeah, for sure. So a lot of people seem to be struggling with anxiety during the pandemic, and there's a list of things contributing to that endless um, just stress. But if there would be one thing to focus on to help people get through this, what would it be? What would you say?
So it's interesting that some of this has to do with us. Some of this has to do with who we are. And I've worked in chronic illness for many years in the LGBTQ plus community, in the HIV AIDS community, in medical communities like cancer. And if there's one universal truth is that living with uncertainty is ever present for us all in many different ways. And it's not comfortable. And we just in the year that is 2020, we are living with uncertainty on so many levels. That's so complex. And then on top of that, you add in this cancer diagnosis. And when it really boils down, the part that has to do with us is that we go about our lives every day, all of us, including me. And we have the perception that we actually have more control over things than we do. And in a lot of ways, it's because things might be going our way. It just happens to be that until you're up against something like cancer or a pandemic or both of them together that are just so far beyond anything we've had to deal with and out of our control. And it's really about that feeling of control when you think about that. And anxiety is a lot more complicated than that, but I'm talking about this for a very specific reason. The reason is this. I really encourage people to think about what's in your control and what's out of your control. If you have to actually pull out a piece of paper and write 2 columns and put something in each column, I recommend it, because what we think we're worried about, the things that we may be most anxious about, may actually be some of the things that are outside of our control. And to focus there just adds to that anxiety. It fuels it. It's not that those things shouldn't make us feel anxious. Absolutely, they do. But what can we do about that? Let's look at that column of things that is in your control. So what does that look like? That could be that I don't know much about this new diagnosis, so I need to be educated about it. That is something that is within our control. How we get that education is one thing, but we can make a plan for the next step to learn about it. Maybe it's that I don't know how to communicate with a healthcare team. Well, what's the plan to learn how to do that? So in control is where we should be focusing our attention. And sometimes through focusing on those things that are in control, we might find that some of the things that are in that out of control column, they're still there, but maybe because we're feeling that we have at least some concrete steps that we can take, maybe those things aren't making us feel as anxious as they did before. Does that kind of make sense?
Yeah. Yeah. I mean, as a person that I will admittedly tell you, I like to be a person in control. And
Uh-huh.
when you get a cancer diagnosis,
Yes.
it's almost like you have no control. You're not a doctor. You don't know, like you can't say, oh, you know, you have a cold, just take Robitussin and you'll be fine. It's like I literally have no idea what I'm supposed to be doing. And so you have these physicians that are telling you, this is what I recommend, this is what you should do, you know. And personally, you know, when I was going through trying to figure out if I was going to have a double mastectomy
Mm-hmm.
or just a mastectomy, there was just a lot of relinquishing control because I had to listen to the doctor and hear what her recommendations were for me, you know?
Absolutely.
So that can be something that is very scary if you are a person that's a planner and
Yes.
to be feeling like I've got control of my life. And it's like, at this point, you got to just release that, you know, control and take that guidance from that doctor.
Absolutely. And this is a time where it's important to reach out for help because there are some people who already struggle with anxiety, who may, you know, by history, maybe they're taking medication, maybe they've been seeing doctors to address this. And even when you have had good control in those situations, it might be time to reach back out, to check back in, whether you've had some sort of diagnosis or not, where anxiety is concerned. You know, so the list works for some, but that's the part that becomes more complicated for others. If this is an existing issue, or even if it never has been, but it feels really like it's the weight of the world sitting on your shoulders, this is the time to reach out for help. And that's one of the most important things, especially because some people have never had to reach out for help before, or it's been a long time since you had to reach out for help. So instead of trying to figure out, how do I do this alone? Talk to your doctor to say, I'm feeling really anxious about, and fill in the blank. And at that point, if a referral is needed, then the doctor will tell you who you need to go see or what you need to do to address it. You know, maybe it is focusing on the things that you can control. And that's one of the things that you can control as well, reaching out for help.
And I think one of the things that helped me the most was building my own breast cancer community, because
Mhm.
I was like, I'm 33. People are saying you don't have to worry about getting a mammogram until you're 40. And so I created my own breast cancer community, which was so
Mm.
essential and so needed in helping me get through what I had to get through. Because there were two other women that I met, and we were all kind of like stair step
Mm.
apart from, you know, our treatment plan and all of that. So we kind of went through it together. And so that is something that I think is also really essential, is finding people that are like yourself, that can understand and relate to what you're going through, because the emotional part of it, physically I feel like it sucks, but the emotional part and having that mental and positive mindset is what helps you get through it.
Absolutely. And at the cancer support community, I mean, community is a part of our name, right? The part of our organization. And we truly believe that community is important no matter where you find it. And for you, you found that community, which is great. And that's something that is super important. Reaching out doesn't always mean it has to be to that healthcare professional, but reaching out could lead you to a new community as well, sort of like what you're describing right now.
Yeah. Yeah. um so living with uncertainty in such a central part of what so many people are trying to cope with, how can we move forward when facing the unknown?
So you can move forward by realizing that you do have a choice. You have a choice to move forward. And that it seems counterintuitive, but it's also stopping for a moment, taking a breath, and realizing that you do have a choice to move forward. And it's something that we skip past. And that gets back to that issue of that control, right? Because it's like, wait a minute, I can choose to do that? You can. It doesn't mean that that's going to be an easy road. It doesn't mean that you have to focus, 6 months into the future. But sometimes that feeling, that living with uncertainty, is because we're focused on many, many things all at one time. And, or it could just be the situation too. But it's realizing that it is possible to make a plan, it is possible to move forward, and realizing that you do still have choices in what's going on, even though it doesn't feel like it. I mean, let's face it, most of the time, even though you've never had cancer before you hear that word the first time, we've all had very difficult things that we've been through in our lives. They're going to vary a lot. For some people, it was that really difficult divorce that they went through. For some people, it was having to go to school at night while raising children during the day. And we have important lessons that we've learned from that. And that's where that resiliency comes in, because people are really more resilient than they realize or that
Absolutely.
they give themselves credit for. So it's like,
Oh, yeah.
whenever people are talking to me, I'm listening and I'm saying, you know, she's a pretty resilient person. She's really strong. She was able to do, and I start listing those things out in my mind, but it's helping that person in front of me to say, or to say to themselves, you know what? I have been through something before. And I did learn some things from that about myself. Maybe you don't know the actual steps because cancer is new, but perhaps you just need to be reminded that you've been uncertain at other times in your life, and yet you're still here to tell me about it. So it's connecting to those parts of yourself, and also learning new skills in terms of how to live with that uncertainty. That's where our helpline comes in, and other professionals like your nurse navigator, that's where they come in. So it's a little bit of taking some new things that you're learning through this current experience and connecting it with the person that has lived a life already where you've already been resilient through some other probably really difficult situations, and kind of marrying those together.
Yeah. Being resilient is something that is essential
Yes.
in life.
Hmm.
I think that, you have, you know, you fought through this and beat that and overcome this or that. But when it comes down to the next hurdle, it's always like, how am I going to make it through this? And so it's important to have those sources and those tools that can say, hey, I know you don't know what the heck's going on right now, but I'm going to help you
Right.
that I can.
Right.
It is something that is very comforting because it is scary.
It is scary. And you know what? Research tells us that resilient people actually don't run away from those challenging situations. They lean into those situations, which
Mhm.
again probably feels very counterintuitive, but it's through leaning into it that you can move through it and start to put one foot in front of the other to actually move to other parts of it. And in some cases, move beyond it.
Mhm.
So if we're running away from it, we can't make the kind of progress that we need to actually deal with that uncertainty, to
Mhm.
actually move forward. And it probably sounds like these things are so easy to do. And I don't even acknowledge that part of it. There are going to be some hard days there. But how do you get through that hard day? How do
Mhm.
because sometimes it's not even that entire day. It could be getting from moment to moment that's hard at first. And then after you learn how to get from moment to moment, you learn how to get from day to day. And after you learn how to get from day to day, you get from, you understand what I'm saying? You know how to
No,
get from week to
absolutely.
week and month to month. And one day you look back and say, wow, look at where I am today. I don't
Oh,
have it all figured out. I might not even know what my next step is, but learning in that process what's helping to carry you through all of that is so empowering.
oh my God, absolutely. I remember I got my breast cancer diagnosis on like a Thursday, and it was like right before the 4th of July. And the doctor was like, hey, we've got your results back, and you have breast cancer. And so I was just like, okay. I like literally, like, I think I cried my eyes out
Mm.
till, so it was like a holiday weekend. So I didn't get, so let's say it was a Thursday, I didn't get to meet with the oncologist or whatever until maybe that next Wednesday. So I'm just like, oh my God, how am I gonna, what, like, it would have been more comforting to say, for him to say, oh, you're stage whatever, stage 1 or stage 3 or whatever. And so for those like 4 or 5 days, I had to live with that anxiety of being like, I could be stage 4, or I could just be stage like 1. And like, so it's there was a lot of anxiety in there.
Yes, I bet.
And I think about those even now during the trying times that I go through in life, and just remember that, like, you are resilient. You have overcome so many things, and you will continue to.
Yes, it's just not knowing. That's the thing. It's the
It's
not
not
knowing.
knowing. It's
Yes,
and that's
that's the
like the
biggest piece.
yeah, yeah. What's the most important thing you want someone who's living with cancer, or anyone for that matter, to know right now who's struggling?
We want you to know that without a doubt, these are really tough times. And we acknowledge that. We're not trying to take that away. We're just there to come alongside you in those tough times. It might feel like you're in the trenches. We're there with you to help you sort through all of these things in front of you that feel so overwhelming. And the other thing is something I mentioned earlier, which is that community matters no matter where you find it. Community is one of the strongest things that can help you to get through something as overwhelming as a cancer diagnosis. The other thing I would say is that we truly believe that no one should have to face cancer alone. That that really drives everything that we do.
That's it's Yeah, it's really important to have a tribe around you, whether it's, you know, from the cancer support community or your neighbor or, you know, your parents or whatever. It's really important to have those people to cheer for you, because there are times when you are going through this that you are going to go into a really dark space and feel very hopeless and helpless.
Mhm.
And you're going to be like, why me? You know, I definitely was like, I'm 33 years old. I just got married. I just moved into a new home.
Mhm.
Like, my fairy tale has now come to an end. You know what I mean? And
Yeah.
you know, it's very hard to kind of to deal with. And I have, you know, been in contact with women that have said, like, I need your help. I need you. I don't need you to give me medical advice, but I need your emotional support. And that's one of the great things about The Young and the Breastless, is that a lot of people read the blog and was like, she's really funny with like this blog. Like, this is kind of like a sad thing, but she somehow made it really humorous. And so anyway, it's whatever um tools and whatever support that you can have is always should always be welcome and is always appreciated.
Absolutely. And I love that you used the humor there because people cope in different ways. And,
Mm-hmm.
so for some people, it's poetry. It could be, dancing. It could be, and for you, it's humor. So it's still tapping into those things that make you, you. To even thinking about what we were talking about a little while ago in terms of putting one foot in front of the other. These are feet you've had your whole life. What are the things that, even the positive things that help you get through that?
Right.
So, right. But at the cancer support community, we are a pan cancer organization. And so, no matter what your diagnosis is, we have resources for you. We have educational resources. And as I mentioned earlier, the discussion boards within my lifeline, they are, some of them are diagnosis specific, not just, a practical concern specific or patient or caregiver, but so we do have resources no matter what your diagnosis is. And the other thing that I would say before we conclude is that when you hear the word community, I think people automatically think about, like, I need to go and sit physically in a support group. And if that is something, I mean, as much as you can do that in 2020, but
Right.
if that is the kind of support that you're looking for, then we do have brick and mortar locations across the country. And you can also find a location of a cancer support community or a Gilda's Club near you. You can also find that on our website. So whether you want to talk to someone, you want to type to someone, you want to sit there, or and these times be in a Zoom meeting perhaps with them, we have various ways for you to connect.
Amazing. I'm not sure if we even have questions right now that we can take, but before we conclude, I was hoping that you could just tell us a little bit about COVID-19, the research that Project CSC is working on. Like, what?
Sure.
Expect?
Absolutely. So we're trying to understand how this pandemic is impacting that relationship and communication between patients and their providers. And the survey is open to cancer patients who are in treatment or who have recently been in treatment, like as of the beginning of this year. And we are looking for people who are 18 years and older. So if you're interested in knowing more or participating even, then more information is available at the Get Involved section of our website.
Amazing. Okay. Um, I don't think that there are any questions at this moment. So this has been a very insightful evening. It was a pleasure to speak with you.
Likewise.
I hope that all of our viewers were able to take some valuable takeaways from this. And once again, thank you to the National Coalition of 100 Black Women DC chapter. And thank you to the cancer support community.
Thank you so much for having me.